Hi, this is Ben. Let's work through the equation for renal clearance. Clearance describes the amount of plasma that is cleared of a certain substance X per unit time. It has units of milliliters per minute. Try to remember that as we move forward here. Clearance is equal to UV over P, where U stands for the urine concentration of a generic substance X, V is the urine flow rate, and P is the plasma concentration of substance X. Let's work through a few cases or scenarios here so we can understand this a little bit better. Let's say that after infusing drug X in a patient's blood, we come back an hour later to find the plasma concentration, in this case Px, is very high. What do you think this means overall? This would mean the clearance of X is actually pretty low, which makes sense. If Px goes up, then Cx should go down. Another way of thinking about this is that the plasma concentration of anything that's renally cleared will be high when the kidneys aren't functioning well. As we age, our kidneys' ability to clear drugs and waste products decreases. How do you think this affects drug administration in elderly patients? We generally want to give a lower dose of renally cleared drugs to elderly patients and to anyone with renal insufficiency. This is because they will have a higher plasma concentration of whatever drug is given to them simply because their kidneys can't clear as much of that drug. Now for another scenario. What if we found the urine concentration of substance X was very high after that hour of infusion? What do you think this means? Well, this would mean that the clearance of substance X is very high. A lot of that drug is gotten rid of in the urine. It's also intuitive that the higher the urine flow rate, or the higher the V in this equation, the higher the clearance of any substance. This makes sense because the more urine produced at a given concentration, the more drug that can be carried out of the body. Measuring the clearance of a substance and comparing it to the glomerular filtration rate can also give us an overall picture of how the nephron is processing that particular substance. Remember that the glomerular filtration rate, abbreviated GFR, is the amount of plasma that is filtered through the glomerulus per minute. Now let's work through a couple of additional scenarios here. If the clearance of a particular drug is less than the GFR, then what is the nephron doing to the substance after it is filtered? Well, the nephron is actually reabsorbing it. This is because the amount of substance that is cleared is less than the amount that is actually entering the nephron, meaning it is being reabsorbed. Now for another case, what if the clearance is actually greater than GFR? What does this mean that the nephron is doing to that substance? Well, in this case, the nephron is actually secreting it. Secretion happens downstream from the glomerulus, and it's the only way clearance can ever be greater than GFR. And then finally, what if clearance equals GFR? If the clearance and the GFR are equal, then there is no net secretion or reabsorption.